Most heart attacks are considered preventable. Most people who lose mobility never think it's going to happen to them. When pain takes away movement, cardiovascular decline often follows right behind it. I'm Dr. Tammy Penhollow, and today we're talking about the connection between heart health, movement, longevity, and why preserving motion may be one of the most important health span strategies we have. Joining me today is Dr. Robert Todd Hurst, founder of Healthspan MD, nationally recognized preventive cardiologist, former Mayo Clinic cardiologist, and a physician whose entire mission is helping patients avoid heart attacks instead of surviving them. In fact, since shifting into preventive cardiology, Dr. Hurst has not had a plaque rupture event among his active patients. That's remarkable, because here's the reality. You cannot maintain cardiovascular health if pain, arthritis, or spine problems slowly take away your ability to move. And that's why this conversation matters. Dr. Hurst, welcome to Mobilize and Energize.
Well, thank you, Dr. Penhollow. I'm really honored to be here and excited for this conversation.
We often say on this channel, motion is medicine. From a preventive cardiology perspective, how important is physical activity to long-term cardiovascular health and longevity?
Well, critically important. I'll give you two backstories when you asked me that question. One is I remember one of my main mentors as a cardiologist was Dr. Appleton. Dr. Appleton is one of the smartest people I've ever met, but he would always say the fountain of youth is exercise. That was really a profound statement. Realize this was 25 years ago, at a time when maybe that connection wasn't as prominently known as it is now. And yet he knew it because he was a master clinician. But I think the training, the ability to do physical activity became a foundational part of my practice because, when I started the Heart Health and Performance Program at Mayo Clinic, at that time, preventing heart disease was borderline alternative medicine. It was, people weren't really sure that you could do it. I wasn't really sure that it would work either, but I had faith. I wanted to at least give it that college try. I was about 8-10 years into having that program where I'm, realize I'm taking care of the highest risk people at Mayo, the people with aggressive artery disease, young people with aggressive artery disease. And I realized, wow, nobody's having heart attacks in my practice. It was two-pronged to that. One is I realized we need to start telling people about this. Like, they need to know that heart attacks are optional. They're not just bad luck. But the other part of it, it really kind of triggered an existential crisis for me because I saw my patients who were not having heart attacks, and I was grateful for that. But I also saw them getting older, getting frail, losing their independence. And I really went through a time where I'm like, well, maybe dying of a heart attack isn't so bad after all, like if that's the consequence. What I've realized, over time and how it's shaped my practice is I need to go beyond preventing heart disease or heart attacks if I want the best outcomes for my patients, and I do. So now we think about that longevity being avoiding preventable disease, avoiding becoming frail, avoiding cognitive decline. Those are the three pillars that we're looking at. And it's almost a rare person that I see these days that does not have some limitations from an orthopedic issue or pain issue that I can see is foundational to them getting the results that they want. Generally, people say, they don't, living forever isn't the option. It's that they want to be high performers, being able to take care of themselves, be mentally sharp for as long as they can. And one of the big barriers to that is injury and orthopedic issues that are not addressed well.
I see them come to me, and then we look backwards at, now that we've got your shoulder better, that you can walk again, we've got to get that cardiovascular health back up to par too. So it absolutely is a continuum.
Yes, it is. And I know you've seen this as well as I have, is that many times the biggest risk are people are falling behind and they don't realize it until it's too late. They're getting weaker, but they don't recognize it until they fall and break the hip. They're at higher risk for heart attacks, and they don't realize it until the heart attack comes. And we see this destructive cycle, right? That one thing leads to another. They get an injury of their hip or their knee, and then they're not walking as much, which leads to weight gain, which leads to their sleep not being as good, which leads to their blood pressure being higher, which leads to higher risk for stroke and dementia and heart attacks. What we do, what you do and what I do is let's turn that around to a virtuous cycle, how things are building on themselves in a positive way. So somebody that couldn't walk before, now they can. That leads to them doing the things that make them happier, that leads to their health getting better over time as well.
And you've put it together. You've just shown that cascade of things, how this begets this, begets this. But do you think when you have new people to your practice that musculoskeletal decline contributes more to cardiovascular decline and overall aging than most people realize?
Oh, yeah, 100%. Like, I'm really concerned about my patients who come to me with concerns. Usually, people who are in my practice, oftentimes they've had a heart scare, whether it's a high calcium score, or they found out their LP little a is elevated, or they maybe, God forbid, they've had a heart attack, or they've had a stent or a bypass surgery, and they're like, okay, I need to turn this around. I want to take full advantage of those opportunities. And if we are limited to not being able to use physical activity, man, we've lost one of our most powerful tools. Like that's a really challenging thing. It's like, trying to climb Mount Everest with a 100-pound backpack on your back. Like, it just makes it so much harder. When we can solve that, take that 100-pound backpack off their back. It's not easy now to climb Everest. Still is a challenge, but now it's doable. Now it's possible. And that's why, in our practice, as you likely know, we do a physical therapist guided strength, mobility, functional movement assessment. We assess VO2 max as a tool of fitness. We do DEXA for body composition because those being able to be physically active, essential to achieving, the quality of life, the longevity that people want.
I love that you have so much data. And this brings me to the next question. When you have data, you have a patient that is doing okay, and then let's just say they develop some back problems or their knee just gives them horrible. They advance from grade 3 to grade 4 osteoarthritis, and they're starting to begin motion limitation and activity. What kind of metabolic changes are then you seeing in the data? Specifically, are you seeing changes in big, ApoB? Are you seeing an LP little a? Are you seeing VO2 max change? What data can you then point to and say, look, this is even more reason that we need to get you back to moving?
100%. It's metabolic markers of health that are the most commonly and most profoundly impacted. So, assessing metabolic health is complex because there's a lot of different measures we're looking at. It's A1C, it's fasting insulin level, it's fasting glucose level, it's triglycerides, HDL, but also body composition as well, visceral fat, body fat percentage. That's the norm, is that I'm seeing somebody back for an evaluation. I see their labs and things have gotten worse. And I'm like, what's going on here? Like, why is that? Why are they, why have they fallen back? Because that's not my expectations. This is, I want, continual improvement. And invariably it is, oh, well, I had an injury, or, I had whatever the setback was, that they were not able to be physically active. Sometimes it's going on vacation for a long time, right? Like, they lost their home court habits. And so absolutely, like that's a really, really important thing that I realized, and why I set up my practice, is that all of our members, we're doing labs and a DEXA every 4 months, because I want to know, I want early warning signs if things aren't going the right way, because I've seen what the consequences are where we're doing labs every year. Well, we missed a big opportunity to get things lined up in the right way. But it also, I think of something you probably have experienced in your practice as well. We all have our blind spots, right? Like, we can, I'm world class at fooling myself. I'll oh, my daily ice cream habit isn't so bad after all. Like, I'm okay. Okay, weight's up a couple of pounds. I'm fine. It's not an issue. Then I get my lab test or my DEXA, and I'm like, okay, really? Like, I got to face some reality here. And that's an important point. Like, it's humbling, but it's also, I'm grateful for that, because it gets me back on track. It points out my blind spots.
Yeah, this is obviously something you and I strongly align on: prevention before catastrophe. In your world, that's preventing a cardiac event. In mine, it's maybe helping somebody avoid major orthopedic surgery. Do you have a specific case or an example where you've seen proactive medicine so much more effective than reactive care?
It's daily, frankly. Like it's been a very exciting way to practice. When I opened my practice, Healthspan MD, I have to admit, I'd left Mayo Clinic because I saw the limitations of a traditional system. And, I'm not disparaging Mayo Clinic. I have mad love for Mayo and respect for what they do, but it's a very reactive system, right? Like, well, when you have the problem, you come and see us. And thank goodness they're there. Like, I still utilize their services for selected patients of mine because they need a procedure or they need an acute care reactive approach. Thank goodness we have those people that do that. But I also realize for those people who want a proactive approach, they want to stay out of the hospital. They want to get the best chance of avoiding those procedures. That's a different approach. We need to be understanding root causes. We need to be, understanding risk. We need to be personalizing the approach to them. And we have to think outside of a disease-focused model. And it was an epiphany for me at Mayo. I've gone through, a lot of training like you did. 4 years of medical school, 3 years of residency, 4 years of fellowship. It was quite humbling for me to realize a few years into my practice, the only tools I have are a procedure and a pill. Like, that's all I know. I don't know anything else because I've been trained in a disease-focused model. When I look beyond that, I'm like, gosh, there's things like exercise, like nutrition, like stress, like sleep, all of these other factors. One, it allowed me to see like what the possibilities were. But going back to when I opened my practice, I'd never done it before. Like, I didn't really know if it would work. I thought it would work. I hoped it would work. But, here I am 3 years after opening the doors here and seeing the transformation of people and their health has just been so profound. I'll just, off the top of my head, and these are just people from the last 2 weeks. I'll give you 3 examples that I've been excited about. One was a gentleman that I saw first in February of last year. At the time, he's a mid-60s, incredibly dialed in on his health. Like, he's slender, he's a pilot, and he had a calcium score 4 years before, and it was high, which shocked him. He got another one right before he saw me, and it was even higher, scared the daylights out of him. He came to see me. We did a CT angiogram because calcium score doesn't give you all the details. Well, he had a lot of soft plaque as well, not just calcified plaque, but he had a severe blockage of his proximal LAD, the widowmaker, the main artery down the front wall of the heart, as you know. And I walked through why I didn't think a procedure was the right thing for him, a stent or a bypass surgery, because, he's active, he feels good, he went a long time on the treadmill, his heart is structurally normal. And I explained to him, okay, look, you can have the procedure, but the outcomes are the same either way. Why take that on? Why not do an aggressive prevention approach? And that made sense to him. Unfortunately, he had another doctor that he was talking to at the time who scared the daylights out of him, said, oh my gosh, you're not going to get a stent. Like, you're going to die. Who's this crazy cardiologist that you're talking to? Fortunately, he hung on. He didn't get the stent, but we repeated his CT angiogram a year later, and his severe blockage is now moderate. So he's regressed his artery disease. Same day, I had another patient. When they do the CT angiograms with plaque composition, they measure the amount of plaque in the artery. It's a volume measure. So their soft plaque volume a year ago was 320 cubic milliliters. Repeat a year later with really aggressive prevention approach, 157. Cut it in more than half. But the last one I'll talk about is a gentleman that's been in my practice for about 2.5 years. And we do DEXAs for body composition in our patients so that we can understand muscle mass, we can understand visceral fat. And he's somebody who's really, he puts the effort in, like he does the work as well. and is looking at his DEXA from when he first met us. And he was a healthy guy at that time to where he is now in his mid 70s. He's added 14 pounds of muscle and lost 18 pounds of fat. Crazy, right? Like it's just remarkable. And I could really go on and on and on. And so I think that the point there is not I have magic. I don't do anything that not everybody else in the world knows. Every other doctor knows works. What I do is I partner with my patients to figure out how to deliver it for them. And I'll just say it works. We'll say I've had that same experience with you, people that I've sent your way that, that were out of options. They've been to Barrows and Mayo and orthopedic surgeons and been told either, oh, it's surgery, or even in one case, but there are no options. Pain management medicine. And you were able to change that trajectory for them. So I'm really grateful to have people doing what you do well so that I can do what I do well, all with the same intentions of how do we optimize this person's health and help them achieve their goal.
Absolutely. That collaboration portion is critical between specialties. We are living the dream, essentially, when we're able to preserve not only the lifespan, but the health span of our patients. And one of us can't do it all.
Yeah.
You don't do musculoskeletal, I do. I don't do cardiology, you do. And we each have our niche where we can help patients in this very personalized, individualized way. So I want to highlight that. You are highly prevention focused. It's all about personalization and it's not insurance driven. What is it about this way of practicing, these systems that we've now put ourselves into and created that's improved individualized care for patients? And what is it that they need to kind of look over and say, this is actually the way that we need to go because outcomes are improving? How do you explain that to people? Because not everybody gets it.
I'm listening to this book by Simon Sinek, and he was describing this concept of a circle of safety, and he gave the analogy that from Aesop's fables is that these antlered deer in Africa, right? They would be together and the lion would come around and they would all get in a circle of safety, which, no matter where the lion came, it was looking at horns, and so it wouldn't attack the deer. But the deer decided they didn't get along, or they didn't have the same incentives, or they weren't looking out for each other, and they went off by themselves. And then the lion was able to pick all of them off. And I'm sure you get this as well. Sometimes people come, they hear about my practice, and they love the idea. They're like, oh my gosh, I've been looking for this my whole life. But then they hear I don't take insurance and they're frustrated. They're like, oh, well, this is a money-making, thing. And I have to explain to them, it's not about making money. Frankly, I was having to spend a lot of time with insurance companies before. Now I get to spend that time with you when I went to that model. But what I do now aligns incentives, meaning that I have a circle of safety around their health. My only incentive is to optimize outcomes for my patients. Like I want them to, the longer they live, the less heart disease they have, the longer they're my patient, the more they're going to tell other people. So it's all great for me, plus it's the right thing to do. They're aligned as well. And then my collaborative partners, like we're all aligned. We provided a circle of safety around their health. But when you include insurance companies, corporations, private equity, what is their primary objective? It's not your health. It is the bottom line, enhancing shareholder value. Go to United Healthcare, go to any of them. Once you see all the words, look for what their primary objective is, and it will say enhance shareholder value. They're not in your circle of safety. They're out doing their own thing, leaving you vulnerable. I believe, what I believe a lot of people are realizing is that if they are going to accept the default option, which is, oh, well, I'm only going to get care that my insurance company has deemed appropriate for me, they are going to be vulnerable to problems that they don't need to be vulnerable to. And I know I'm preaching to the choir when I talk to you about that, but it's, I went away from an insurance model because I was frustrated with the system. What I learned going away from an insurance model is that's how I get the best results for my patients. I was limited in what I was able to do for people because I had to follow the insurance rules. When I took those off, things like our results really amplified. So in the end, it was the greatest discovery I could have discovered, is going away from an insurance model and understanding I charge a fair price. I deliver exceptional value. I deliver things that people aren't getting in a lot of places. And I'm proud to be able to do that. And I do it at a high level. And the return on investment for what you get with my practice, I think that's way better than the return on investment on getting your bypass surgery covered.
I love the circle of strength, the circle of certainty, the circle of health span. That's a wonderful way to put it.
This was a patient that I saw just yesterday, and he's done a really great job with his health. His numbers are all optimal. But he's struggling with the pain issue. It's not from anything he did. It was just one of those things. Life came up, right? And now he's dealing with chronic pain. And he asked me this question at the end. He's like, okay, well, what needs to be my primary objective? What do I need to do? And his cholesterol is great, and his blood pressure is great, and his body composition is great, and his fitness is great, and everything's great. But while we were talking, he was telling me I got chronic pain. Like my foot hurts all the time. And I just, I sometimes I can't sleep because my foot won't let me sleep. And he's like, what is it, the thing that you need me to do? And I said, address that pain. Like, that's the thing. It's going to wear on you over time. It's just going to keep chipping away at, and it was objectively noted, like his fitness was an elite level before. Now it's only high level. Still great. Like, he should be very proud of where he's at, but you could see the impact this pain has had on him despite his best efforts. So I think that would be one of the things that I would really emphasize in this is, how it all ties together. I know medicine is very siloed. You have the musculoskeletal specialist, and you have the kidney specialist, and you have the heart specialist, and they don't always talk as well as they could or should. But when you look at it from a biology standpoint, it all works together. Like it's all integrated. And I think thinking about your health from that perspective, it can be a real asset for people.
It is. And you're thinking proactively, not responding to. I just can't say enough about corrective care versus reactive care.
There is trying to head off those disasters. I mean, that's the system, right? When you have the heart attack, we'll try to pull you out of the fire. Well, when it comes to heart disease, about 25% of people, their first sign they have heart disease, they die. And so no matter how great the cath lab is, and they are great, that's just it's a flawed system that is, leading people, literally hundreds of millions of people, to suffer from disease they don't need, early death, all these things. It's not just a feel good story. It works. And it's people like you that's, helping open people's eyes to the possibilities of this.
Well, thank you. So I think it's easy to conclude longevity is not just about adding years to life, right? It's preserving the ability to move, to stay independent, to stay mentally sharp, and to continue doing those things you love for as long as possible. Dr. Hurst, thank you again for joining me today and for the work you're doing to shift medicine from reactive disease care towards prevention and health span optimization. For those who want to learn more about Dr. Hurst and Healthspan MD, his website and all of his social channels, hint, it's Healthspan MD, will be linked below in the description. Until next time, keep moving.